Hello again, this is Angela Westover, MN590 student with Purdue Global University. Welcome to part 2 of the Nurses Workstation Ergonomics program. This lesson will be on computer ergonomic principles. The program objectives specific to this course include increasing the nurse's knowledge on computer workstation ergonomics and improving the nurse's ability to identify and correct risk factors related to computer ergonomics. At the end of the last course on biomechanics, we discussed nurses and work-related musculoskeletal disorders. We talked about how poor biomechanics can lead to the cumulative trauma cycle and how this contributes to repetitive stress injuries and work-related musculoskeletal disorders. We discussed how globally nurses have considerably high incident rates of WMSDs. We also talked about injury prevention through ergonomics, which includes preparing your body with stretching and exercises, maintaining good posture and alignment of the kinetic chain, avoiding destructive behaviors by developing good technique and work practice habits, and optimizing your workspace by making adjustments as applicable. In this course, we'll go into further detail about some of those injury prevention methods. So what is ergonomics? It is best described as being the science of the design of systems related to how humans interact with its parts to include the equipment, job functions, and overall work environment. Ergonomics can be applied to various nursing tasks such as patient handling and transfers, lifting, moving, twisting motions, computer use, nursing workstation design, and body positioning for even just sitting or standing. Applying ergonomics in nursing can help to reduce complications such as injury, disease, and WMSDs. It can be implemented quickly and easily without any real significant cost or time. However, it may require critical thinking and careful consideration in order to be applied, especially when workspaces are shared. Ideally, equipment such as monitors or chairs should be adjustable. Over the past few years, there has been a significant increase in nurses using computers for patient care. This includes desktop computers, workstations on wheels, computers mounted in patient care areas, and even mobile laptops or tablets. Many studies have found, or are finding, that nursing workstations were not originally designed with much consideration to ergonomics. Workspaces or counters are too high or too low, and cabinets and other items were maybe inconveniently placed. It's also significant to note that many nurses or nurse stations still do not have ergonomic equipment available, such as the adjustable chairs and monitors. Applying ergonomic principles to a nursing computer workstation is multidimensional. This course is not all-inclusive, and there's much more that can be said about how nurses can optimize a computer workstation. However, for purposes of this program, we will discuss how to apply ergonomics to computer workstations by adjusting the environment, work practice, chair, monitor, keyboard, and mouse. Increasing knowledge on computer workstation principles allows the user to apply as many principles as appropriate to their individual workspace. Again, this may require critical thinking and conscious effort when the adjustable equipment is not available or the workspace is shared. We will start with ergonomic principles that are related to the environment, as these impact computer use and user comfort. The lighting in the room should be adjusted so it is not too bright or dim, and in such a way that any potential glare or reflections can be minimized. Sound should be reduced so that it does not create increased muscle tension or distraction for the computer user. Temperature should be controlled so as to not provoke the user's stress, but to increase their comfort. Again, adjust the temperature so that the cold does not increase the user's muscle tension. Control the heat so it does not contribute to the user's exhaustion. Ergonomic principles related to work practice include taking rest breaks often. For every 30 minutes of keyboarding, the user should take micro breaks of at least 15 seconds to 3 minutes. For every hour of being seated in the chair, breaks of at least 3 minutes should be taken. These breaks are great opportunities to incorporate ergonomic stretching exercises. Whether seated or standing, the human movement system should remain neutral, balanced, and straight in line. The principles of rest periods and overall body position are applicable whether or not the equipment is adjustable and the workspace is shared. Other workstation ergonomic principles include the work surface height and item placement. As we previously discussed, some of the more outdated nursing stations may have work surfaces that are too high or too low. Ideally, the work surface should be able to be adjusted to a good working height per the individual, so as not to overly abduct or elevate the shoulders with the use of keyboard or mouse or when other tasks are being performed. Items that are frequently used should be within an easy reach so that any excessive extension or twisting motion can be avoided. The image you see here demonstrates ideal horizontal and vertical reach zones for optimal ergonomic performance. Keeping items that are very frequently used within the green zone will help to avoid injury. Ideally, nursing workstations should have chairs that can be adjusted in many ways in order to accommodate different users. However, one of the biggest ergonomic errors that nurses make with the use of their workstation chair is not sitting fully back into the chair. Often, nurses are moving in and out of their chairs very quickly that they do not take the time to properly place their body. Once the user is sitting fully back into the chair, then any existing lumbar support should be correctly positioned into the user's lumbar curve. The height of the chair should be adjusted so that the feet are flat on the floor, or a footrest may be used if the chair is not adjustable. Knees should be bent at a 90-degree angle where the thighs are horizontal or parallel to the floor. Any tilt of the chair should put the hips at no more than 90-degree angle. The armrest should typically remain out of the way for extended periods of typing, but could be available to provide support for other activities, so long as they do not overly abduct or elevate the shoulders. Understanding how to adjust your chair to meet your individual needs is important to decrease stress on the spine, hips, knees, and ankles, especially for those that are sitting for extended periods of time. This has great impact on many parts of the kinetic chain. I provided a link for a video on how to adjust an ergonomic office chair. Different chairs have different components, but the chair in the video has many features that may exist on chairs within various workplaces. Ideally, the height of the monitor should be able to be adjusted for different users as well. Incorporating monitor ergonomic principles is important for reducing eye and neck strain. Whether seated or standing, the top of the screen should be at about or just below eye level, so that the head and the neck remain straight in line. It's important to note that many standing desktop converters do not fully elevate the screen to always support this ergonomic principle. When transitioning from seated to standing or from standing to seated, the height in relation to the user's view should be reevaluated and readjusted appropriately. Also, when using laptops, it is incredibly difficult to incorporate this ergonomic principle in conjunction with ergonomic principles related to the keyboard and mouse use, so keep that in mind. The distance of the monitor to the user's view can vary. Viewing distance may range from about 15 to 30 inches, or typically is the length of the user's arm distance. It's acceptable to have a slight tilt in the screen, and it may be necessary to limit glare and reflection. Here I've provided a YouTube link for a very brief video that explains and demonstrates adjusting the computer monitor. Ergonomic principles related to keyboard and mouse use are critical to apply to prevent multiple issues such as tendinitis, carpal tunnel, or trigger finger, just to name a few. Many of these principles can be applied even when the workstation is not adjustable. However, it would be ideal for the height of the mouse and the keyboard to be able to be adjusted so that they are at or close to the same level. The height of the mouse and the keyboard should be at such that the elbows are at 90-degree angle with the forearms and hands straight in line to the keyboard, and the shoulders are not overly elevated. The keyboard and mouse should be at a distance that allows the shoulders to stay relaxed and the elbows to remain relatively close to the body. Aside from being on the same level, the mouse should be within relatively close proximity to the keyboard so the arm is not outstretched during transition of use. There may be a tilt in the keyboard, but it should generally be flat or slope no more than 15 degrees. When keying, use caution not to apply excessive force, and take the pressure off of the wrists by keeping them floating while using the keyboard and the mouse. When using the mouse, you should move the whole arm in line rather than bending or twisting at the wrist and creating abnormal movements that can lead to pain and discomfort. I provided the link to a YouTube video in which an occupational health physiotherapist discusses and demonstrates ergonomic principles related to the keyboard and mouse. Although it's not necessary, I highly recommend viewing it because, again, these principles can be applied even when the workstation is not able to be adjusted. I would like to note again that nursing computer ergonomics is multidimensional and this course is not all-inclusive. But to summarize, we talked about various ergonomic principles that relate to factors such as the environment with lighting, sound, and temperature, work practice with rest periods, overall body position, work surface height, and item placement, the use of chairs with body placement, backrest, height, tilt, and armrest, the use of a monitor and their height and distance, and finally, the use of a keyboard and a mouse with consideration to the height, distance, proximity, tilt, and pressure. Upon completion of this course in computer ergonomic principles, you should have an increased knowledge about computer workstation ergonomics and an improved ability to identify and correct risk factors related to computer ergonomics. The final course of this program, NWE 3, Applied Ergonomics, consists of a practicum or skills validation, which requires the user to utilize a provided checklist to assess their individual workspace and apply computer workstation ergonomic principles. Thank you again for joining me in this course. I look forward to seeing how you assess your own environment and apply these ergonomic principles. If you're finding that your environment has an outdated workstation design and/or there's a lack of adjustable equipment, I encourage you to advocate. Speak up to your leadership about how you can optimize your nursing computer workstation by applying ergonomic principles.